Yeah, ovarian malignancy is also commonly seen in our population. So, majority of the times, patients with ovarian malignancy remains asymptomatic. That means patient will not get any type of symptoms for longer times. So, whenever patient gets symptoms, that means patient uh, got like very advanced stage because of the ovarian cancer. So, so whenever patient becomes symptomatic, so means because of the cancer, patient is getting symptoms. At that time, ovarian cancer is like in very much advanced stage, like maybe like stage 3 or onwards. See, in this cancer, because ovaries are like deeply seated inside our abdomen cavity, like in the women's, and whenever they get enlarged, uh, so maybe because of the sight, so we are not able to see those, and patient also will not get any type of symptoms. So whenever this type of tumor grows, so they can grow in the size like 10 centimeter, 15 centimeter, and they will start spreading inside the abdominal cavity. And after some times, there will be some fluid collection in the abdominal cavity, and because of which we can see abdominal distension. When this type of distension do occurs, patient will become symptomatic. They will be able to say that some uh, the size of their abdomen has now recently increased, and maybe some patient can get discomfort. So some patient can get like uh, decrease in appetite. So sometimes some patient can get dyspnea, abdominal discomfort. Some patient can get abdominal pain also. And whenever this type of cancer again uh, goes from like stage 3 to stage 4, sometimes they will get like pleural effusion, that is fluid collecting inside their lungs. So this type of things and complaints do occur in the patients of the ovarian cancer, and patient usually present with this type of complaint to us. When we evaluate them, maybe in the terms of like imaging, CT scan, PET CT scan, and third investigations, we will come to know that this is like a ovarian malignancy. See, ovarian malignancies do happen in most commonly with elderly women, and where there is family history. So there are like first and second degree relatives who have like breast and ovarian malignancies from uh, those families. The incidence of the ovarian cancer is very high. So this is called as like genetic causes. So where BRCA1 and BRCA2 type of mutations, uh, so mutations, this type of mutations happens in BRCA1 and BRCA2 genes, and because of this, the incidence of ovarian malignancy, the breast cancer increases significantly. Yeah, as such, we will not be able to like prevent uh, getting ovarian malignancy. I can tell you the like common things from which we will be able to maybe get rid of all the cancers. So, except some genetic cancers, we will be able to prevent other cancers which are very much sporadic. So 90 to 95% of the all cancer are sporadic. Only 5% to 10% cancer are genetic. So those cancer which happens because of genetic mutations, uh, as such we will not be able to prevent them from happening. For genetic cancer, if we want to treat them, so we have to do for the early surgeries. Likewise, those patients who got like BRCA1, BRCA2 mutations, they can go ahead with like preventive surgery like bilateral like breast mastectomy, that is called as breast removal surgery, ovarian removal surgery. So likewise for the stomach cancer patients, colon cancer. So for stomach cancer, maybe so there is when there is history of like stomach cancer, we can go ahead with like a preventive surgeries. So preventive surgery is the method by which we can plan for uh, like uh, cancer prevention. Other ways to prevent cancer for the sporadic population, sporadic cancer in general population is by uh, like I can say control of like addiction, your addiction like tobacco, smoking, chewing. So these are the type of addictions where patient can consume alcohol. So most of the time cancer do happens because of the addiction this type, and 30% of the cancer do happens because of this type of addictions. Other 30% of the patient can happen because of lack of exercise, lifestyle modification changes, so like food habits, so everything. So when we'll be able to keep our food habits proper, so and regular exercise, so by doing this we will be able to prevent like 30% of the cancer happening because of these things. So other 30% of the cancer do occurs because of the environmental factors. So maybe it is related to like environmental pollution, ultraviolet rays. So all this. So it can also be prevented. So 90% of the cancer which are sporadic, we will be able to prevent it by certain modifications which we can do it in our lives.